Welcome to Green Talk by Green Care Solutions on KCAA NBC Radio, iHeartRadio, Spotify, and YouTube. Today, we have my man, Ben Baller, legend in the game. I'm your host, Breal, and while we're quarantined, we're being safe, keeping our social distances from each other. I'm here video Skyping with my co-host.
What's up, everybody? It's your girl, Angela Mazzanti. Now, remember, this is a cannabis-friendly and educational program. You must be 21 years of age to watch or listen. And we're not doctors, but Green Care Solutions has doctors for you. And NBC Radio is considered an essential business. And as long as we follow all these CDC guidelines, we should be good.
Yes, and also follow GCS on Instagram at Green Care Solutions 420. They have a website, greencaresolutions.com. Also, this show is brought to you by Keyzone of Van Nuys. They're an essential business as well. If you're locked out of your car, house, or anything right now during the quarantine, give them a call. They'll help you out. Their phone number is 818-437-9399. Their IG is Keyzone Locksmith, right here at the bottom of the screen. And their website is keyzonelocksmith.com. Also, Breal and Ben Baller, I think he's going to hook you guys up if you guys ever get locked out of anything. He already told me that.
Amazing. I actually need one.
Nice. He's in Van Nuys, so he's, in LA. Mm-hmm.
Word up. Welcome to the show, my man, Ben Baller, man.
What's up, dog?
I've known you for, many years, over 20, probably like 30 years or something like that, close to 30 years now. I know the path you've been on, and we've talked about it on other platforms, but you started in music as a DJ. Then you became an A&R in the music industry, and made some great moves with some iconic hip hop legends that are considered now. And, somewhere along the line, you jumped into the jewelry game and, just constantly recreating yourself, man. And I got to say, hats off to you, because everyone gets down with Ben Baller.
Thank you.
So, Ben, I've noticed on your social media, you've been posting a lot of stories and IG lives about the coronavirus, COVID-19. Let's talk about that right now. I mean, it's a great pandemic. We're living history, guys. I mean, I'm here with my hand sanitizer. I do have my gloves and my mask. Like Angela said, we are essential business. We're keeping our distance.
We've been very distant all day.
Yes. And what can I say? This is our reality right now.
It's it's not the part of history I'd love to be a part of, but like my mom would always say, sometimes you can't choose what's going to happen in life and what you want to do, and this is what's been brought upon us. And the only thing that I can say is that I got involved early. I tried to spread awareness. I think Kobe's death kind of definitely overshadowed that, because it was very light at the end of January. Nobody was talking about it at the end of January. Nobody was even talking about it at the beginning of February. I began to mention it on my social media February 4th, 5th or so, and then I started talking about it on my podcast around then. Was very early on it. There was one single podcast speaking about COVID-19, at least on the top charts in the top 200. And, the reason why I got so involved in it is because my oldest son has respiratory illness, and it could kill him. He falls into first of all, I don't want to blame anybody. I've been doing a lot of blaming, and it's not that good of it's not a good thing to do. And what's going on is there's a lot of misinformation out there, and there's a lot of bad information out there. So with all that said, even doctors who have spent 20, 30 years behind medicine, there's epidemiologists, there's virologists, there's scientists, they can't even figure out all the answers, right? And they've said things, and it's mutated, it's changed,
it's like a pneumonia, then it's a flu. There's so many different studies.
But there's so many different. There's even 2 strains of the COVID-19 that's going around. There's other things that are going around. So it's like, what it is let me just discuss real quick. Early on, they said that it was an elderly disease, and it affected people who had pre-existing health conditions. Well, obviously with Italy and USA, that's not true. Because, near half the deaths are people under 44. I'm sorry, I'm 47. I know I'm old and washed up, but I don't consider myself
You're very
elderly. You know, I mean, even about 50, I don't think it's elderly. Elderly, I think 75 at least, or
75 plus at least.
maybe 65.
Senior
even,
citizens
okay?
is 65, I believe.
Elderly is considered 65 and above.
So elderly 65, think about it. You got rest in peace to JG, my boy, passed away last Wednesday. He went to a ski trip to Italy with a bunch of homies and they got it. No pre-existing condition. What had happened was, I think that he thought he was sick. He got tested. By the time he was able to get a test, it was still considered early in California. His lungs seized. So he got pneumonia, his lungs seized, and then he was on a ventilator. And then someone was saying something about, I'm not exactly sure, but it's something like, you can't stay on a ventilator too long. It's kind of like, I don't know, it's like, what's the term for lack of better? It's like, you know, if something, if like drugs, for instance.
Your lungs become like dependent on it. Yeah,
you can't go cold turkey. You have to kind of like taper off, right? Something happened. I didn't talk to him for 5 days. And the next thing I know, his wife said she was sending voice notes, and that's how she said goodbye to him. And he passed away. And,
did he have a pre-existing condition?
Nothing. This dude was six pack. You know what I'm saying? Good dude is just
good shape. He took care of himself. He was pretty much healthy.
Took care of himself. Ate well. White boy.
Why do you think? Why do you think that they allowed so much? All of this misinformation along with information that they obviously didn't have.
You know, bro, look at, man, like I said, I was trying to blame a lot of people. I was really mad at some people, but I said this before. There was a game that people played back in the day when you were in school, most likely grade school, maybe high school. The teacher gives somebody a word and she says, hey, this is the words. That person spreads it around the entire room. By the time it gets back to the entire room, it's like, let's say the word was green thumb. Now it comes back and the word is Mexican. Because people, that's just the way things are. And with the internet and millions of people on the internet, the translation and the lost in translation and just everything just gets to, you know, one person says, oh, 17 million people got sick. Oh, no, what are you talking about? Only 3 million people got sick. What are you talking about? Actually, only 8. And it just, my issue is this. This is where if my son didn't have the respiratory illness he has, I don't think I'd be so obsessed with it. And because he does, I became an advocate for it, and I've kind of it's taken over my life, you know. But with that said, I love China. I love Chinese people. Is a big difference. When people say hate Trump, some people who love this country may think you must not love America because you don't like Trump. That's not the case. So the same situation in China, there's the CCP, which is Chinese Communist Party. President Xi is the chairman. If they were more transparent and didn't have to we'd have to find out 2 months later by the White House from a sealed classified document that they lied about how many people were infected, how many people got sick, and how many people died. You know, they said 3,200 people died. And then the classified document from the White House said that it was in the 6 figures that died. Now, that was a long time ago before they shut the entire country down, which nowhere else on the earth. Only a communist country could shut down. You think anybody could tell B-Roll what to do? B-Roll, don't go in your car. Mm-hmm. Don't leave your house even to get food. B-Roll's gonna be like, yo, man, you're tripping. You know, and it's like
rights, etc.
Yeah, China did that. Mm-hmm. That's one thing I have to admit. That's amazing. But at the same time, if they had been more transparent with the infection numbers or anything else, I think people would have been like, all right, wait a second. This is just the old person's disease. Only 3,000 people died. But realistically, a lot more people have died. I don't know why the media hasn't put that out there. But with that said, if you do the basic math, if you see how fast the deaths were happening in Italy, now the only thing that Italy has a lot of smokers.
Close living.
Very dense cities there, elderly population.
But they also kiss each other on the cheek.
Yes,
you know,
exactly.
Kiss, the way that their interaction. Mm-hmm. When they smoke weed, they even put tobacco in the weed, which I hate they do that there in Paris. Mm-hmm. In both those places, right? Going on.
Europe, yeah.
That affected a lot of the deaths because their deaths skyrocketed and people are like, they surpassed China. No, they didn't. And finally, you know, no one wants to play the blame game, the Chinese virus, people, Asians getting beat up, and there's all kinds of things going on. Look, man, let's just get people the right information. Exactly. Now, with America, our sense of obesity here is much different than anywhere else. And we have a lot of fat people
Latin
in America.
And has in some own countries too.
And so I decided to study 20 people in the month of March that passed away. 20 because those are the people I can find information on, where they grew up, what they look like, blah, 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 whatever. The 20 people that I was able to get more information about where they grew up and certain things or whatever, all 20 of those people had been 25 pounds overweight. So that's You know, I'm 25 pounds. I'm like right there at that border with that gut. You know, it's a scary thing. And so with that said, why take a chance? You know, I tell people all the time, people don't take it serious. They think it's a joke. I'm telling people it's raining outside and they're talking about getting a car wash. I'm telling people, look, man, if there was such thing as a 25 bullet revolver and you put one bullet in there and it wasn't Russian roulette. So I guess it'd be Italian roulette and you spin it. And it's like, okay, would you take that chance? Now, the bullet might not even kill you if it does shoot you, but imagine you're taking a chance. And on top of that, people are finding out so late. They didn't talk about this in February. They talked about it in late March, that people who had no symptoms, asymptomatic people, were the highest carriers of the COVID-19. So you can have no symptoms. You can feel really good.
Exactly.
And see, that's a part of that they didn't have all the information, or they didn't give all the correct information. You know, they said that we knew as far back as November and didn't do shit about it and didn't do anything about it. And, you know, the pandemic research to combat these type of viruses and stuff like that was dismantled and whatnot. So then after this, you have the media putting out all this information that it only affects the elderly and people with preconditions, right? And so you have all these young folks feeling like, well, that doesn't really affect me.
Well, and then seeing like all the ticket like numbers for like planes and stuff going everywhere, like flights to Hawaii were like $150. Like, so most of these young people were like, oh, well, I'm going to take my chances.
But my point is that they felt like they were unaffected. They didn't know that they could be carriers. And so they were, I think, dismissive of the information that the media was out there. And then you see the media do a flip and start trying to scare the young folks into getting with the program. And now they're reporting more deaths of younger people that have no, you know, preconditions and stuff like that. So it's crazy how the media has now went from, you know, taking it, you know, not necessarily lightly, informing people, but now they're more so trying to scare the younger generation into getting into what everybody else is doing. In other words, you know, the self-shelter and stuff like that. I mean, now most states, with the exception of 9, you know, you're starting to see them implement policy where you got to go out if you go outside, you have to be wearing your mask and gloves. Now they're finding people if they see them walking down the street or going into a place without the mask and gloves.
You got to carry a note from your essential business that you're allowed to work. But look, man, be real. This is my main issue, right? And I hate to blame people, right? There's a tweet that the Surgeon General had put out stating about masks and things. And I went at him, you know, I mean, I have enough followers to, I think that he definitely saw it, and I added him. And I said, man, look, I came from, you know, was born and raised in America, but I'm from mask culture. People in Korea and China, they wear masks on a regular basis. People in Japan, they don't sneeze in the street, man. They cover their mouths. They're just a little more aware of their hygiene when it's just being out and things. And I said, look, man, you can't tell people that. You can go on YouTube to learn how to properly wear an N95 mask or whatever. Cover yourself, protect yourself. Everyone should take care of their own responsibilities. And he went out and said that irresponsible thing. The CDC put the statement on their website. All of a sudden, 7.5 weeks later, now it's a requirement to wear a mask. You're confusing people. You got the President of the United States of America telling people in February, hey, look, there's nobody affected. It's fine. It's a hoax. And like, you have to understand, if the president told on national television, went on TV today and said, hey, 3 + 2 = 7. I just found that out. I'm sorry to tell you this, but 30% of America probably believe that 3 + 2 = 7 now because he said that. So, you know how confusing it is, like, oh, well, it's not, maybe it isn't. And then, you know, it's like, now he's saying, oh, it's a pandemic. Now it's this. Oh, we want to open by Easter. No, we'll open by August. Hey, man, people are confused. My mom is confused.
The Prime Minister of England is in intensive care right now.
It's mixed messages, you know, because on one end you had them, you know, maybe a week and a half ago, 2 weeks ago saying, don't buy masks, you don't need them. And all of a sudden it's, hey, you need to have them if you're going outside. And that's the type of thing that is confusing people and sending a mixed message like, we don't really need to worry about as much as they're saying. And yeah, some people don't. It's not going to affect.
It's costing lives now.
But it is costing lives. Exactly.
Mm-hmm. And sometimes I feel like maybe it was a lack of funding in the beginning, because then eventually there was a bill that was passed, or $1 trillion were passed to help figure out what this virus is, and now they're figuring it out. But at the same time, it might have been too late if we would have put that funding towards the virus in November. Angela and I were discussing that we think the coronavirus, the strand of the coronavirus, which is COVID-19, has been around since November as well. So many people that we know that are healthy, no pre-existing conditions, got so sick from a flu that lasted about 3 weeks, and it could have been the coronavirus, but there was no funding towards the research and no tests. Obviously, there weren't any tests, and some of the tests weren't as accurate.
The funding got taken away.
Oh, yeah.
And when a reporter asked about that, he denied it. Like, I didn't do it. Did you do it? And the other guy was like,
it's literally, it's amazing. Look, I even said something. I'm one of the most immature 47-year-old people I know in the world. I'm still a father. I'm very responsible for certain things. I couldn't imagine being the president. And I mean, at some point, you don't have any feelings. But even more than that, look, as much knowledge as I have on this version of coronavirus, I didn't know it was November. I thought it was sometime in December.
Let me ask you this, Ben. Do you think that he's running 48 laws of power?
No.
You don't think? No, I'm saying trying to.
Oh, yeah. He thinks he's yeah.
He thinks he's running it, right?
Yeah.
Nobody talks about that, but if you've read that book.
For the first time from you, and dog. Right on, spot on.
If you read that book,
yeah, I read
a lot of the stuff that he's doing is the principles in that book. The thing is, he doesn't have the skill set to finesse it to like make people believe it. Like we all know that a lot of the things he says are untrue. We all know it. But one of the premises in the book is that believe the lie and keep saying it.
He's felonious, bro. He does believe the lie, you know? He's just... But look, man, my son got really sick in the middle of February. A lot of people, like I said, they were sick. During All-Star Weekend in Chicago, it was freezing cold. A lot of people got sick. My son got really sick. I had to get back, figure it out. The last place I wanted to go, and this was when hospitals weren't getting crowded. I just didn't want him to go there because a lot of people were going to Cedars-Sinai, and just in triage, there was 200-300 people in there that were getting sick inside triage. So that if you didn't have it, now you got it because you got caught in there with all those people in there. So my son was the first under 18-year-old person in California to get tested for coronavirus. And what happens is from the people, I have 17 friends who have tested positive for coronavirus. The ones that were early on, it was a very scary situation getting tested because the Army's involved and things like that. But going on, the surefire sign that scares people is this. My son got tested for the influenza and the strains. He tested negative. When he tested negative, that's when it started getting scary because that's the surefire sign. From everyone that I know that's got it, they always tested for the flu first. If they said, I haven't been around anybody in China, I haven't been around anybody in Italy. Like, okay, did you get tested for the flu? Because yeah, what happened? Oh, negative. And then that's when the CDC gets involved. It's like, oh, you're negative? Okay. So that's what scared me. My son had something else, but then my son ended up getting walking pneumonia, which is really crazy. And we got the test. But people were mad at me, so I deleted it from my page. But people were mad at me for showing that my son had taken a test because they said, hey, man, only rich people and celebrities can get tests. And look at Trump even said, they asked him, how'd you get a test? And whatever. He goes, seems like you just have, to be rich or famous or popular or whatever. And he says, that's the story of my life. Now, I wouldn't answer like that insensitive, but, I did everything I could and contacted everyone I needed to and spent 7 hours on the phone to get him a test. And I did finally. And that's what I don't think, I was just persistent with it. And some people are lazy, whatever, but I wanted to make sure I got him a test.
Mm-hmm.
Yeah, because they don't know, they don't necessarily know that you're calling in, that it's, they
have no idea.
Yeah, because they're probably they're overwhelmed right now. They're just
oh my God, bro,
dealing with it any way that they can. So if you're persistent enough, no matter who you are, you could probably, break through.
Oh, there's rich people I know who are trying to get a test and they can't. One of my fans said he was on the phone with the CDC for 4 hours, called the hotline. After 4 hours, his line disconnected or his cell phone disconnected, whatever. He had full, whatever it was. That's frustrating.
People who just who are getting sick and are just doing the right thing, obviously, and like staying indoors and staying inside. So we really don't know the numbers of like how many people truly do have it because of all these people who are taking those precautions. Like, okay, I'm not feeling well, I should just stay inside. Where like on TikTok, there was like a point of so many different people just like going to get tested, like in the drive-through lines that like they were starting to pull up once more tests did become available. And it's just crazy. It's like if you're able to and you're able to just stay inside and like take care of the sickness on your own, then do that. There's no reason for you to go outside and potentially get somebody else sick.
And I have a question for Breal and Ben too. What do you guys think? Are we going to be I mean, this is opinion. We don't know because they always say 30 days and then there's another 30 days of quarantine. Do you guys think we're going to be in quarantine till June? And then after that, maybe California would somewhat get back to normal. Maybe everybody that goes back to work has to wear this and get a fine if they don't. How do we get our economy back roughly?
I'll let me talk.
I mean, you know, I think it's something they can't really gauge, and we definitely can't gauge it. I mean, we're hopeful that we get back to work as soon as possible, but it just depends on how serious people end up taking this in terms of like, you know, distancing and taking the time to, you know, self-isolate or self-quarantine, whatever. I just think that, you know, there's the misinformation sort of
ruined it.
You know, put us behind
exactly.
and ruined the timeline because a lot of people took it serious, but a lot of other people didn't. And the fact that, you know, we knew since November and did nothing about it until after the fact. I mean, you know, we're hoping that it's 30 days. We're hoping it's not any more than that. But, you know, I would definitely see some new ways of lifestyle in our culture in terms of how people greet one another, how people are in their work environment, going to and from the work environment in terms of the gloves and masks. I don't think that will necessarily go away. You know, it's like Ben said earlier, you know, in certain places, like let's just say Japan, they're a mask culture. They walk around the city with masks on since before all this started happening. You know what I mean? I think that we'll probably adopt that lifestyle. Maybe not everyone will be wearing masks and gloves if there's no fine or penalty to not wear it. But I think you'll see more people, especially with health conditions, you know, adapting and making that a part of their lifestyle, part of their culture, you know, mask and gloves.
This is what I think about real quick. Like, this is where the situation is. It's going to be a couple years before we get back to normal. Normal meaning what it was for us in January to walk into a Dave & Buster's or a restaurant or a movie theater or whatever.
I agree. That's what I'm thinking.
A game, whatever it may be. Now, with that said, November, December, we find out it's serious and Trump or whoever is in charge of pandemics says, hey, man, you know what we're going to do? Now, the crazy thing is, I thought about this too. Like, that would have made maybe Kobe be alive by now. Kobe would have been alive because what they would have did was said, listen, January 1st, we're locking USA down. I don't give a F. Where are you from? Whatever else. We're going to give you 3 days to get back home, figure it out, whatever, blah, blah. We're shutting down the country. January, all of February, maybe part of March, and then we'll open the country back up. By now, we would have been open. We would be able to do what Hong Kong has done. They've locked off the borders for a while. If you enter, you're not a Hong Kong citizen, 14-day quarantine, 30-day quarantine, depending where you're from, where you came from, checking the passports, checking everything. It took a long time. It was a nightmare. But these guys are walking around the city, at least, and some of the restaurants open, some things. Now, nightclubs, you know, karaoke's aren't. But what I'm getting at is if we had taken it seriously, you know, early on, yeah, you know, but we haven't. So there's so many people around, even Wuhan. 12 million people in the Hubei district in Wuhan. 5 million people left the country before the virus even became known. So that was crazy because I was trying to figure out why the hell there's so many people in Italy. Then my buddy who works for Gucci, I don't mean a Gucci store on, you know, the actual Gucci corporation. He's like, bro, what are you talking about? What do you think all the people in Italy and all the factories, they're all Chinese. And
They're
I was like,
all
oh
Wuhan.
my God. He's like, bro, you guys have Mexicans working in all the places. He goes, we all have Chinese people in the factories here for Louis Vuitton, for Prada, for this. And I'm like, yo, you gotta be kidding me. He goes, bro, they came from Wuhan, came here, boom, and infected it. It comes fast. They came to LA. They're all over the place. So with that said, B-Real said is right. I think on the public transportation side, for someone like my grandma used to take the bus, I used to take the bus. The metro might be a little scary now. You know, the 17-year-old boy who died in Lancaster, California. How did he get the virus? He got it from his dad, who's an Uber driver. How come he died? He went to urgent care and they wouldn't give him health care because he didn't have insurance. Then it went to deeper and there's just so many things that are going on. I think that B-Real said, as time reveals itself, right, more information comes out. I just watched something and I stopped watching the news for 4 days because it was depressing me. And I'm like, look, man, there's a lot of people died, a lot of people are sick. All right, I don't need to know anything else. What else is going on? Nothing else. So I'm just going to do something else, read, work on some jewelry designs, whatever. I turned on the news today and they said, look at the numbers from early April. I'm sorry, the first week of April. So Monday last week. And then now we're at Wednesday. Today's Wednesday?
Yes.
So we look at Wednesday and the deaths went over double. And I'm like, oh my God. Mm-hmm. So they're multiplying at a crazy rate. And it doesn't seem like it. Because you're like, oh, damn, 3,000, 5,000, whoa, 6,000, okay.
20,000.
14,000. No, I'm talking about in America only.
Yes.
You're like, whoa, they went over double. So what about next week? And then they're talking about, oh, we haven't hit the peak yet. I'm like, well, Jesus Christ, then why would you want to be out? Like,
yeah, why would you want to be out?
let's let this peak hit. Let the peak hit. When it hits, cool. Look, eventually they're going to have to open up because I do think on a business aspect, me being a small business owner, I own 3 businesses, right? At a certain point, we're going to have to figure something out. And with that said, how people do get really sick from the flu, I know there's no vaccine right now. It's going to take 12, 13 months because you got to get the FDA to approve it. Then you got to go through clinical trials. Then you got to worry about side effects and whatever, right? So until then, people are going to have to adopt the masks, the gloves, be more, don't touch a door with your glove, then touch your face or anything after. You got to sanitize your gloves even. You can, whatever you got to do, you got to be very aware of what's going on if you don't want to get anybody sick. Be mindful, take your clothes off. If you're at a grocery store, if you're somewhere, just be smart because someone could have sneezed in the air and 5 minutes, which is a long time, 5 minutes you walked in that aisle now, you don't even know if those particles, because they're microscopic, are in, going in wherever they are. So with all that said, I think the economy, we haven't even addressed this, but I mean, the economy where it's at now, and it just keeps going lower and lower and tanking, that alone is going to not kill physically, but it will mentally destroy so many people stress-wise of not having the money. That's another thing.
Yeah, I think that there's, I can't remember what theme park was talking about this, but they were talking about adopting a plan to, take those eye thermometers or whatever and, check people's temperature before they come into the park. Right. I think you'll start seeing that in a lot of places.
But what about the asymptomatic people that don't have a fever? Do you know what I mean? They're carrying.
Still carrying it.
Yeah, of course. Those ones you can never tell. I mean, how could you ever tell?
Hopefully we'll all be tested.
They have a new 5-6 minute test, but still.
But what I'm saying is, I don't think that people that are having customers come in, they're not going to take the time to give someone a test. That would take long and that would put people off. I think they're starting by taking the temperature.
No, yeah, I get it.
It's less aggressive, I guess. You know what I mean? But realistically, that's one way I think they're going to try to figure out how to keep sick people out of busy places. Mm-hmm. So I think that's something that a lot of businesses are going to adopt. I mean, there was this I think it was like a ramen place in, I don't know if it was downtown or Glendale or somewhere.
Oh, no. It was in Fountain Valley or West.
I think I heard of this too.
Yeah, I remember.
Yeah, and they were the first ones taking people's temperatures.
Taking temperatures. So if you were over 98.8, you were not getting in or something. Yeah, I saw that.
Yeah. Mm-hmm. Well, so I think you may see that, and you never know if businesses put in those detectors that zoom in on people to check their.
They got an airport in China. All the Chinese airports I've been to, they had it during the SARS. I was around H1N1.
Yeah, you're going to see that technology come out ASAP.
Very true.
With B-Real being an old friend of mine, and never once have I ever referred to him as Luis or something, right? I'm just saying, I've always respected his entertainer brand, Cypress Hill, everything. Bro, you guys were the first dudes to hip hop to do festivals or big places that were not necessarily hip hop. And now all these Coachella people are talking about, okay, we postpone it to October, whatever. That's not going to happen now. Obviously, that just can't have 100,000 people next to each other. What do you think is going to happen for your touring and stuff?
Well, I think it's everybody's getting the pushback, every single artist anywhere. And I think you're going to maybe start seeing performances from in-house or personal studios, right? Maybe not necessarily, it just, I guess it depends on the artist, right?
I'm not talking about them though, B. I'm talking about
are going to stream.
These other artists are only doing clubs from 400 to 3,000. I'm talking about, I've seen you guys in Europe. You posted a thing on your Instagram where there was 90,000 or 70,000 people. I'm like, yo, bro, like that can never, there's no way, not in the next 2 years because.
I'll say this. If you look at D Nice and what he's doing on Instagram and his live,
yeah.
And even Tory Lane, right? And they're doing some simple, sort of streaming, and they're getting festival-like numbers. D Nice hit up to 200,000 on one stream, and Tory Lane consistently hits 200,000.
Yeah.
And this,
he hit three something. Yeah, no, I get it.
Hit like 350 or something like that.
But what did he do? Is he asked for I guess. No, you answered my question. So I guess you could do that, and you could ask for a or like a Cash App us for keep playing.
Yeah.
I think
you take donations.
Yeah, and I think there's going to be, when there's issues in anything, there's a new people reinvent things. So I think there's going to be streaming that could be maybe free, but then sponsors might pay.
Well, and
that talent to
the cannabis industry, especially, I've seen there's so many events that go on throughout the year where smoke shops, we just had Champs. So every smoke shop goes to pick up their new items for the year. And I've started to see some of these cannabis-based business to business events start to do the idea of a virtual trade show. And I don't know how that's going to work or if it's going to necessarily work. And but that's going to be our reality for the
Probably.
next. Look, it's crazy that it's 420 all month, and yet we can't have a real 420.
I don't do a lot of appearances, but when I do, I won't lie to you. As much as it boggles my brain sometimes, my wife even thinks, I can't believe these many hundred people lined up to meet you, Ben. It's the most mind-boggling thing in the world. I can't believe it's the weirdest thing. One of my biggest meets every year is Hippie Hill in San Francisco, and there's 100,000 people in
so
Golden
many
Gate Park.
people.
My 420 events are always the biggest meet and greets. Guess what?
Gone.
That's how.
I know. Gosh. Well, I'm going to be praying every day that this pandemic comes to an end and that there's a vaccine soon, and hopefully we can get back to normal. If not, we're smart people. Hopefully we can reinvent the wheel in a certain way. I don't know.
And I'm going to pray for all of you guys, especially because I love B and you guys are all family and everything from Green Thumb to Soul Assassins to Cypress Hill to anything possible. All you guys, I just talked to Kenji an hour ago. Listen, man, if there's anything I can help you guys out with, my door, my phone is always open. I promise.
And likewise, brother. And likewise, it's mad respect, mutual love, we got to stick together in these days and times for sure.
Have to.
Thank you, everyone, for tuning in to Green Talk by Green Care Solutions. I'm Yenitza Munoz.
And it's your girl, Angela Mazzanti.
And here we are with Breal as well.
And I'm Ben Ball. I appreciate you guys.
Thank you guys for tuning in. Stay safe. And I hope to have you guys soon on a Zoom call. And hopefully this quarantine will come to an end. And hopefully this pandemic will come to an end soon, too. Thank you, everyone. Be safe.